So is there a frozen shoulder of the hip? Is there a frozen hip? And I made a previous video explaining most of the things that people think are a frozen hip, but the pathologies that are actually what is usually happening with people that have what they call a frozen hip. The frozen shoulder that I speak of is in reference to primary frozen shoulder, which has a systemic underlying piece of it, and it is different than secondary frozen shoulder, although people lump it together. The systemic frozen shoulder is happening because of a cytokine storm and a hormonal imbalance, which changes how the tendons remodel. Frozen hip, the adhesive capsulitis of the hip, has a traumatic onset, such as a fracture or surgery, and all synovial capsules have the ability to become shortened, fibrotic, and freeze with disuse and poor range of motion. And yes, if a person has diabetes, they are more likely to have a frozen capsule of any synovial joint, so any joint can technically freeze. But the frozen shoulder is more like Dupuytren's contracture in the hand than it is like frozen hip. And let me explain why. I have notes saved in my phone of things that I want to remember, and I want to show you about primary frozen shoulder. It is an inflammatory cytokine dysregulation, and this is not unlike the cytokine storm that comes with COVID. There is a chemical reason for frozen shoulder primary, with also an altered expression of immune cells, inflammatory mediators, and fibrosis associated with cytokines in the frozen shoulder. And we know this from pathology reports. Now, there is fibrosis and change in the capsule of a frozen hip. But what makes frozen shoulder unique is it happens more in women during the age of perimenopause and menopause. Frozen hip happens in younger individuals 30 plus before there is a massive hormonal shift. In frozen shoulder, previous studies have identified increased myofibroblast differentiation, proliferation, immune cell influx, and dysregulated cytokine production. And that cytokine production is what I think is the distinct difference between adhesive capsulitis in the shoulder, primary frozen shoulder, versus adhesive capsulitis of the hip. So if we look at this journal article, Adhesive Capsulitis of the Hip, a review addressing diagnosis, treatment, and outcome from 2015, that adhesive capsulitis known as frozen hip has many similar clinical characteristics to those of adhesive capsulitis of the shoulder. That is true because when you have a capsular restriction, you will get a capsular pattern. And yes, the pathology and methodology is not the same. And this is why I said frozen hip doesn't exist. Technically, capsulitis can happen to any joint, but the pathology of frozen shoulder is specific to perimenopausal women. The shoulder is unique. You're more likely to have a Dupuytren's contracture if we're going to go with that science because of the myofibroblast and that contraction, which is not necessarily the same for the hip.